When Lolita came on, she had a vision, a commitment, and a caring heart. Whatever she was involved in that offered quality healthcare services to people, that's what she was going to do.
She's the type of leader who believes in her team, inspires us to do our best.
She's been able to imbue that team with an eye for a place of excellence.
From just 3 employees in 2 small rooms to today, 5 facilities up and down our state, 220 employees, and a $30 million operating budget.
Now having participation across different communities in multiple counties of our state. And so that means the number of people who now have life-saving health care, who now have vaccinations, who now can make sure that their children and their parents are well. That is the kind of impact that Westside has had.
She's kind and decent, a really thoughtful leader for healthcare delivery, I think, most of all, into disadvantaged communities. She was a great advocate, but she was also a very thoughtful, really kind and decent person to work with.
This is a remarkable organization, a community, an institution that has transformed what a federally qualified health center can look like, what it can be, and what it can do.
There is nothing more important to elevate the strength and the health of Delaware than to make sure not to leave behind our brown and black communities, and that has been a huge focus.
Lolita's commitment to caring for the most vulnerable in our community is like none other. It's always about how can we have more impact on the health of those who live in the communities we serve, and we share that commitment.
One of the best and biggest things that we can do for people in this state and I think in this country is to make sure that they are born healthy children, the kids have a chance to grow up, do well in school, and go on to have successful lives and raise their own families. That's really what Westside does, and it really comes from her commitment.
Her vision for healthcare delivery in our state continues on after her service ends.
She's a go-getter. Whatever she sets her mind on is what she tends to get. Lolita is my hero.
Westside was started by nurses who were concerned about the community on the west side of Wilmington and the Hispanic population that was growing fast and had no way of getting health care in their language. So that made me think, wow, this sounds like something I could really sink my teeth into, and story goes from there, my Westside story. Westside started at the Adams Ford Shopping Center in 1988. This facility was a 2-exam room facility. We didn't have a lot of staffing at the time. The growth that I see from beginning of Westside's roots to today is still amazes me every day. We have 5 health center locations in Kent and Newcastle County and a mobile health unit serving our migrant and seasonal farm workers statewide. And in total, we're serving 30,000 people a year.
Her legacy is one of caring, of a woman who was committed, because without her vision and drive and direction and commitment, we may not have had a Westside family healthcare system at all. Because that's what it's about. If you're talking about taking care of people and helping them move from where they are to where they can be, then they have to know that you care about them.
With Westside, they feel comfortable. They speak the language, they can describe what they're feeling, and they don't have to hide, is what helps.
Seeing how she's grown Westside from a staff of 2 and then 3 when she joined to what it is today with over 200 people and serving 30,000 people a year across the state. It's really wonderful to see that growth. It's exciting to see the legacy that she is handing off, and it's a real honor to continue that.
When I think about what is my legacy from the work I've done over 33 years at Westside Family Healthcare, I hope people say that she didn't give up, that she was persistent in reaching the goals of health equity for all and has really made an impact and a difference for the state of Delaware.